Welcome to Deuk Spine Institute. I'm Dr. Deuk Majin. It's June 10th, 2025. Our patient has neck pain when she turns to the left. She has very bad arthritis involving the facet joints. Wow, you can really see it on there, huh, Jordan? That's a lot of arthritis up there, huh? Show the audience the severe arthritis of the facet joints. She must have had a bad injury there. You guys see that with the arrow?
Yes, we do.
Yeah, so we're going to go in and we're going to basically treat those joints with a denervation procedure. What does that mean? Denervation means we're going to take away the nerve supply to those painful joints. And that procedure is known as a rhizotomy, where you go in and cut out the pain nerve, the rhizome. In Latin, rhizome means root. Rhizotomy means remove the root. So you're basically taking away the pain nerve root by removing it, okay? And the concept of removing pain nerve has been around for, a long time, 100 years or more. I'm not the first person to do a rhizotomy. The concept of rhizotomy came about. Anybody know? Anybody know how the concept of rhizotomy came about? It came about from patients with leprosy. You see, patients with leprosy, the parasite that causes it invades the nerves, the sensory nerves, and the lepers lose sensation to their joints, to their tissues. So when they're losing tissue, it's sloughing off from an infection, they actually don't even feel it. So the denervation concept came from leprosy and then from syphilis, which also destroys nerves. So basically, infectious diseases that destroy nerves, pain nerves, are how we learned about the rhizotomy as a therapeutic procedure, because patients with these diseases ended up losing feeling in their limbs. All right, Sean. So we're going for these arthritic joints, and I'm going to basically destroy the pain nerves to these joints. Now, Henry, let's show the audience how we do that.
Of course.
Facet joint injury is a common cause of chronic neck pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. The inflamed facet joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Welcome back. We're almost done. We've been marching down her spine, basically destroying the pain nerves to the arthritic joints in her neck. you can see the bone spurs that are very prevalent on her spine. Those bone spurs are a sign of severe joint injury. Jordan, show us some of the bone spurs. They're kind of coming off of the edge of the spine there. Just about done. And what I'm doing, as you can see from our video, is I'm going down and basically cutting the pain nerves. These pain nerves transmit pain signals from the spine right up to the brain, and we want to interrupt the course of pain signals going from the spine up to the brain. And that is a permanent fix. The other option would be to do a fusion of her whole spine. By fusing the spine, we can get rid of her pain, but we would also lose movement. Sean? We don't want to lose movement. We don't want to take the movement away. We just want to take the pain away. All right. Good job, everybody. We're done. We're going to wake her up in just a minute, but everything went good. I'm very happy with the way it went. She's going to have pain in her muscles now because I just went in there and did a lot of burning of the pain nerves. So it's going to hurt for a little while. It'll probably end up hurting for maybe a week. She had a good amount of bleeding. All the blood comes out through that little hole, but we did the whole surgery through this tiny little hole here. You want to take the eye band off first, or should I staple first? Now, she is under sedation, twilight, so she's sleeping, but she's going to wake up probably in the next few minutes. And when she does, that pain that she came here with should be gone, and she's going to have a different kind of pain, a pain from the surgery I just did. Okay? In which she's going to have to live with that surgery pain for, like I said, a week or two.
Before we conclude, we do have one question.
Yep.
Coming from Lanu on YouTube.
Good job. Thanks.
Asking, what kind of injury did she have? It looks very serious.
Yeah, you could see how big those arthritic joints were. They've grown big over the time, and they were very sclerotic on the x-ray, full of extra bone, so they were dense. I don't know what kind of injury. You guys know what kind of injury she had? No, I think it was lifting. Some kind of a lifting injury, but you know, she works in healthcare. She's I'll just say she works in healthcare, and so she deals with lifting patients. So maybe it was, I think it was some type of trauma. Must have been a traumatic injury many years ago. All right, any other questions?
That is it for questions.
Have a wonderful day, folks. We'll be